Hello.
Hello. Hi. Welcome.
Very nice to meet you.
Thank you very much for coming.
Thank you for inviting us.
Thank you. Please.
I'm going to preface that we're meeting not by chance.
Well, health is not everything, but without health, everything is nothing. One of the major challenges is misuse of antibiotics. They are misused either in human health, animal health, environment. We want to make sure that we not only the preach, but we walk the talk.
Welcome to the Astana Times YouTube channel. I'm at the WHO's home in Kazakhstan. Thank you very much, Mr. Syla, for welcoming us here, and thank you for your time.
It's a great pleasure to have you here, and welcome.
I'm going to preface that we're meeting not by chance. WHO European Regional Committee session is coming very soon. Can you provide us with some insights, initiatives that will be discussed during this event that will, potentially can contribute to the improvement of healthcare in Kazakhstan?
From 24th to 26th of October 2023, Ministers of Health and high-level delegations from 53 member states of European region will be gathered in the beautiful city of Astana in order to discuss the progress that is being made towards improving health and well-being of European citizens, and will be discussing how to shape the future agenda for health. The Regional Committee for Europe is the highest governing body in which are made very important decisions. And there will be 3 days of the event. The first day is political day, in which we expect the addresses by high-level authorities, by Director General of World Health Organization, about our regional director, but also in the first day of the event, Regional Director will present the progress made, so-called, of our strategy, the United Action for Better Health, which is European program of work, and member states will reflect what was achieved, what are the challenges, and what are the future steps towards improving health and well-being. The second day of Regional Committee will be consisting of selecting or electing the members of governing bodies of WHO, like Standing Committee of Regional Committee for Europe, but also Executive Board, which is the highest governing body in which are gathered all member states of the globe. On the final day of the event, we have 4 important subjects. It's about human resources for health. There is prepared resolution in order that health and care workers everywhere in European region, they have decent working places, they are respected, they are paid well, and they have continued professional development. The second item in the agenda on the third day is about antimicrobial resistance, because today we are aware that one of the major challenges is misuse of antibiotics. They are misused either in human health, animal health, environment, and that's why we want to make sure that decision-making people are making a clear roadmap towards effective and responsive use of antimicrobials. The third item is about emergency preparedness and response. The COVID-19 pandemic has shown very clearly that when health is at risk, everything is at risk. We all remember that we worked from home, the schools were closed, and we want now the countries to have better strategies in order to be prepared in the best way. And the final item in the final day of Regional Committee is about health of refugees and migrants. In today's world, we know that many people are leaving their homes and moving to other countries, either due to natural disasters, man-made disasters, conflicts, wars. And we want to make sure that the health and care services are provided to these people that are in need and invulnerable. So once again to say this is one of the highest level events of governing bodies that will be held for the first time in the beautiful city of Astana, And we are very grateful to the government of Kazakhstan, Ministry of Health, Ministry of Foreign Affairs for their huge efforts and dedication to make this one of the best regional committees ever.
Can you tell us projects that were implemented together at WHO and Kazakhstan that were, great contribution to improvement of health in our country?
Absolutely. The health and well-being of all people are at the heart of WHO's mandate and day-to-day work. Kazakhstan is a long-standing partner of World Health Organization. We are being present here almost, there will be 3 decades in 2 years. And since this period, Kazakhstan proved to be a global leader on health. It's to be mentioned Almaty Declaration on Primary Health Care, which is very relevant also today because during the regional committee would be celebrated 45th anniversary of Almaty Declaration, 5th anniversary of Astana Declaration, and before regional committee there will be also held international conference on primary health care on 23rd, in which we'll discuss dimension of primary health care. But apart from primary health care, very often the ordinary people, when they see World Health Organization, they think that we work only with health workers within the walls of health institutions. But we work much beyond. The air that we breathe, the water that we drink, the food that we eat, the day-to-day behaviors that we do, or so-called health literacy, are all these dimensions that we work. We provide standards to the authorities in order to have the best standards and guidelines for air quality, in order that every citizen, from newborn babies to the older people, would breathe the clean air, to have safe drinking water, to have food which is safe and healthy, but also to provide the information to ordinary people how they can invest into their health by doing physical activity, eating healthy food, but also not smoking, not drinking alcohol, and also doing other risky behavior. Other area in which we work very much is addressing mental health problems. Because in today's world, in Europe, but also we see increased number of people with mental disorders. We say that there is no health without mental health. So this area we will continue to work very much. Now, when we are discussing here, there is ongoing 3 days workshop about tobacco control. Kazakhstan made a huge progress in terms of addressing tobacco-related issues, but still we have a huge challenges, particularly about new heated tobacco products, or vaping as it is known, because also young people are exposed to this. We work also on, we had several campaigns on healthy eating, like reducing salt consumption, sugary drinks, energy drinks, and all these that are impacting health. But definitely we will continue to work also on health financing, on human resources for health, digital health, but also addressing communicable diseases like HIV, tuberculosis, and pandemic preparedness and response. And finally, for this, just to share you great news, together with Kazakhstan, we worked on the proposal that was submitted to the pandemic fund, in which we were successful, and Kazakhstan is amongst only few countries in the European region that were successful in getting successful application for next 3 years, about $19.2 million that we will invest in country in order that health systems are better prepared to respond to public health emergencies of international concern. There are many other areas, but we are committed to work closely with government of Kazakhstan, people of Kazakhstan, for healthier and safer future for everyone.
Thank you. It's very impressive, actually, what you've described. What about, you were talking about health literacy. And before we started shooting this interview, you shared with me a very interesting thing you're doing here at WHO Kazakhstan. Can you share that?
We want to make sure that we not only the preach, but we walk the talk. And in our team, we have an application in which the threshold, every staff member who is willing to be part of it, and most of staff members that are working, a great team that I have honored to work, they are part of this, and we make about 6,000 steps a day. Because as I mentioned also in the beginning, physical activity, healthy eating, and our healthy behaviors are important for future having a healthy life. And whoever doesn't meet this threshold, we have also a minimal symbolic fine, which is 1,000 tenge, and this money are collected to be given for charitable issues or any other needs. But this is just a symbolic way to show that people in my team are engaged also on healthy related behaviors, that we are not just preaching, but we are doing what we are saying.
And I wanted to ask you, how our people, what are the results? Who's the championing the initiative?
In our team, you mean?
In your team.
Well, we didn't measure yet, because when we approach the end of the year, we will find the average. But yeah, there are some people also, they are running like half marathon, but in average, everyone is doing quite good.
Oh, great. Good to hear that. As an expert in health and working for WHO for over 20 years, in your opinion, what kind of health priorities should Kazakhstan set for itself? Because in the last 30 years, the country made incredible, strides in improving its healthcare.
For good performance of health system in any country, there are important four dimensions. It's health and care workforce. It means to have health and care workforce that is qualified, that it is motivated, it's paid well, it's secured in working place. This is first element. The second is sustainable health financing. It means to increase the budget for health, and we are having a working group with health financing experts from our Center of Excellence from Barcelona in order to devise the future strategies of health insurance fund. The other element is to have quality of health services in order that everyone is having, every patient that goes to get the health services is ensured that is of the highest standards of the evidence-based. That's why we are doing day-to-day trainings in different fields, either laboratory capacities or infection prevention and control, or non-communicable diseases addressing tobacco or other non-communicable diseases. And also we need, as I mentioned, to work very much with community, the fourth element, to increase health literacy through health promotion education. Because whatever we can increase all the three elements that I mentioned before, but in case that we as individuals do not take steps to protect and promote our health, it's also our responsibility. That's why we will organize, even further engage with community in order to provide the best information to increase.
And your words of wisdom to our viewers.
Well, health is not everything, but without health, everything is nothing. We are aware that when we are healthy, we are happy, but if a family member is sick, everyone gets sick. That's why it's important that every citizen of this beautiful and great country invest in health while we are healthy. And investing in health while we are healthy, young, and starting from, because we have initiatives, health promoting schools from young age, in order to know what kind of food we eat. I mean, properly to do regular physical activity, not to smoke, not to drink alcohol, and also to spend time with friends, with families, in fresh air to discuss, because one of the problems that I mentioned is also mental health. And one of the ways to overcome mental health challenges is to talk to the people. And this is the way that sometimes we are focused very much in social media, spending a lot of time into the electronic media, but the most beautiful thing is to talk to a friend, to a relative, and to overcome this.
Yeah, I totally agree with you. Connection is like the best way to feel better. And I feel better when I connected with you and actually sat down and talked to you. Thank you very much for your time. It was a great honor.
My pleasure. Thank you very much to you as well.